Thanks so much, Tom. I really appreciate that. John, you're going to be talking about where we might be going with Medicaid, and would you briefly introduce yourself as well? Thank you so much.
Okay, thank you. I'm John Hill with the National Alliance for Medicaid and Education. I do want to follow up on a point that Tom had made because I was just looking at this the day before yesterday when he was mentioning that the rate of medical bankruptcies in this country. To put it in perspective, in 2014, that number is over 640,000 bankruptcies because of medical bills. That's a lot. 5-year period, 10-year period, you're looking at 1 million folks. So from there, I'm going to talk a little bit about how we've paid for some of these services, and hopefully we'll be able to continue to pay for some of these services. And there's been lots of efforts that have been going on in the last, specifically in the last 12 to 18 months, to expand those with a number of initiatives that are currently going on that are paying for services in schools. There are basically 4 different ways that our school corporations are able to access Medicaid to pay for services. One of those began back in 1988 when the IDEA legislation was changed and along with the Social Security Act that would allow schools to start accessing Medicaid for IDEA-related services, those medically related services that are delineated in a student's IEP. So that's basically the first way. The second way has to do with many states do a lot of outsourcing in their Medicaid outreach activities, which is referred to as Medicaid administrative claiming. In many of those states, schools participate in that Medicaid administrative claiming or Medicaid outreach, where they help families get signed up for Medicaid. They help families find physicians. They help families find transportation, or not families but necessarily, but the students to transportation to those appointments, line them up for their screenings. All those activities are basically done during the school nurses, the speech therapist, the teacher, the counselor, in a lot of cases the principal, are activities that they do every day in school. For those that states that where the schools participate in admin claiming, that time that those individuals spend on those outreach type and arranging for medical services is allowed to be matched by Medicaid dollars. The third way has to do with what Tom also referred to, was a change in the free care provision that just came about in 2014. It was always referred to as a free care rule. One reason why it has gone away, because there never was a rule. It was never ever anything in statute. There was never any regulation that basically backed up the CMS position that they wouldn't, Medicaid could not pay for a service if it was given away free to other entities or other individuals. You couldn't just turn around and bill Medicaid just because Medicaid was there. Back in December 14th, the Health and Human Services Administration and CMS basically made a change in their provision, felt like that it wasn't in the best public health interest to not do that, especially realizing that schools are a major point of where kids get health care services, not only those special ed kids, but every child that walks in the school door that's seen by the nurse or that's seen by a counselor or a social worker, or is seen in some cases by behavior clinicians. Even some cases, kids are getting speech therapy or some occupational or physical therapy, and they aren't in special ed, so there's basically isn't any funding that's dedicated to cover those costs. Now with the change in the free care provision, if the student happens to be Medicaid eligible, there is mechanisms for the schools to start billing Medicaid for those specific services. And the fourth way that schools, Medicaid enters the school settings is what both of my previous speakers have mentioned, are school-based health centers, which play a critical role in maintaining the overall health of all the students that walk into schools that they have them. Any change in the Medicaid funding formula that's currently being looked at this afternoon as we speak, it's in the committee being marked up, and the change in the Affordable Care Act and the repeal and the replacement of that. There is also language that will make changes in how Medicaid formula runs down to states. I did have a conversation this morning with Representative Guthrie, who sits on the Energy and Commerce Committee. I'm happy to say that he actually represents the area of Kentucky I live in. So I appreciate him taking the time and actually meeting with me and talking to me this morning. The thing that I tried to, they're going to do what they're going to do, bottom line is, and then we'll have to figure out how to make it work, which is what we do. But I just asked him and repeatedly asked him, whatever you do, don't hurt kids. Whatever you do to the funding formula, make sure it doesn't hurt kids. He seemed to get that. He repeated it. He says that's what he wants to say happen. And my response is yes, and the devil's always in the detail. It depends upon how the law comes out, but even more importantly, it will depend upon how the regulations come out. So I tried to remind him that as part of their responsibility, it doesn't end at the passing of whatever law they happen to pass, but also to make sure that they keep an oversight on the regulations that come out after that bill is passed, because that will make a determination on how schools are able to continue to access Medicaid in the future, if they'll be able to, and again, if they are, what it'll look like. That's kind of the nutshell. I'm going to pass my time on to everybody else. There is so much stuff that's happening right now in the realm. We'll be happy to answer questions. So